I think we can start now. Welcome everybody to this very, very special info masterclass today, which will be the other way around because it is the patients who are going to teach us right. I want to introduce you first of all to Mathieu Boud from Red Thread, our generous partner who helped us organize this session, which involved also the patient engagement team at CTF US. And of course, the three patients who are here with us today to lecture everybody on what NF patients actually need. So I would start by just, yes, before I introduce everybody, I need to give some very few instructions regarding the questions. Right after the introductions, we will broadcast a film that has been pre-recorded featuring all the patients and Mathieu. After the film, there will be 20 minutes-ish of time for you to ask questions. You will unfortunately not be able to interact directly with anyone, but you can use the Q&A box or the chat box to ask your questions, and I will forward them. I will ask them back to the team on this end. First, Mathieu, if you'd like to say a few words about you and this masterclass.
Yeah, thank you, Marco. So I think I will reiterate that during the recording, but it was a true pleasure for myself and for Red Thread Solutions to partner with CTF for this masterclass. And of course, I've seen the recording. So thank you and congratulations for the three here today on stage with us. But the five in total, that was a very deep conversation. So I hope all the participants will enjoy and learn things from them. I think that's the most important.
Thank you, Mathieu. Gillian, would you like to introduce yourself?
Hi, I'm Gillian. I have NF1 and I also have 4 children with neurofibromatosis as well.
Thank you. And Damien?
Hello, I'm Damien. So I'm 35 years old. I'm from France, and I've been diagnosed with schwannomatosis since my 19th birthday with several surgery.
And Carmen, of course.
Hi, I'm Carmen. I'm 42 from Spain. I have NF1. I was diagnosed when I was 9.
So thank you, everyone. I'm happy now. I will start broadcasting the pre-recorded session with the patients, and I look forward to receiving your questions in the Q&A box or in the chat box, and for a lively Q&A session afterwards. I hope you enjoy your class.
So thank you, Marco. Thank you to patients who will hear from, and we will hear the perspective from those guys. Today we are joined by Shiva, Carmen, Gillian, and Damien, who are living either with NF1 or schwannomatosis. We will hear perspective from Germany, Spain, Ireland, and France. So thank you very much for joining us for this masterclass. It's very appreciated by us and by the community. So before this masterclass started and before we recorded today, we did some pre-work all together, and you mentioned a few topics that are relevant for you and that you're willing to share with the healthcare professionals and also with the healthcare system. So I would really like to thank you guys to share your perspective in English. This is tough. So thank you so much for going. And the first topic is logistics. So we heard a lot, and mostly from all of you, that
medicine, for physical therapy, for psychotherapy, or like getting the referrals for the different specialists for the appointments. And another thing is that the specialists or special clinics for NF are sometimes very far away from the place where you live, and you have to travel far. You have to coordinate it with work, with your family, and that's sometimes can be a huge struggle. So I think it's really important to take that into consideration, and yeah, realize that many patients with NF may have cognitive impairment. It's not for everyone, but many patients have that. So it's important to like get to know the level of cognitive ability, the level of intelligence of the patient, and start to work from there and see, okay, where does the patient need more support? What can the patient do on its own? Yeah.
Thank you.
First.
Thank you very much. Thank you, Shiva, for sharing this story. What you told us as well is that you experienced difficulties in where you live and where the specialty centers is, and this is often linked to logistics and as well to cognitive impairment. Can you share your story regarding this topic?
Yes, I can. Like, for example, I live about 500 kilometers away from the next center in Germany, so there might be more in other countries closer, but in Germany, where I have to go from insurance-wise, it's always a half a day that I have to travel. So it's really a lot. It's about like 1,000 kilometers for each time I want to see a specialist, and I have to organize with my family, with work now, of university, with all the other private stuff, and that can be quite challenging because you have to plan the appointments also very far in advance. And if something spontaneous occurs and you book the hotel or you plan the day, and then the doctor gets sick and they call you 3 days before and say, yeah, we have to postpone the appointment, then it's it's not nice. So yeah, and I don't have a big cognitive impairment. I can manage it, but I can imagine that many people, I heard from many people who have problems, that they are overwhelmed with what they have to do. They don't get the right support, and then they miss important stuff.
So one of the solutions would be to increase the support from the system to these patients regarding organization of the trip, logistics, appointment with the doctors, etc., and so on and so forth, right?
Yes.
Thank you very much. So to join a specialty center and a specialty clinic with all the specialists, you need to get referred to that. And we heard from the four of you that was a challenge in every country. And I would like to hear specifically from you, Carmen, in Spain. How did you deal with this situation? What for you is the main issue when it comes to referral in this system, to be addressed to the right doctor, to the right specialist?
Sometimes is my hospital is not the closest to me, maybe 5 minutes. Sometimes I go to a town I have reduced mobility, and sometimes it's very challenging to have to take the private transport because maybe the public is not the space for you. That is the money, the time is the same as Shiva said. It's complicated and it's very exhausting.
No, I can understand. I think you said it well. Damien, I'm turning to you now. It's about finding the right doctor, the one that who is the specialist in your disease. For you, is schwannomatosis. So how does referral system works in France and in other countries? Did you hear about this as being an issue for many patients?
Yes, it's a major subject, principally for people doesn't living in Paris and that in other areas in France. In schwannomatosis, the main main doctor we deal with is the neurosurgeons and the pain specialist. This is the two main doctors, and of course general practitioner. So, but for the really specific following of the schwannomatosis is some neurosurgeon, but all of them are not well capable with this illness. So this is a special neurosurgeon, and sometimes patients, specifically at the beginning of the schwannomatosis, don't know where to go, and when they address their general practitioner, the general practitioner doesn't know well the specific sign of this illness, because this is not really specific. This is pain, but sometimes difficult to localize, and the nerve tumors are not at the beginning easily defined. So there's a lot of patients that I spoke with that took a really long time, in months, years, before being addressed to the reference center. And in France,
how does that, excuse me to cut you, but how does that happen? How can you be addressed to the reference center? How does it work? There is a central system. People know about it. Tell us more.
Now, on the last years, there is internet sites, but before typing in Google, I have a schwannomatosis. First, you have to know if you have it, and at the beginning, signs can be, there is just little sign at the beginning of the schwannomatosis. So before that, yeah, I think what is lacking is that general practitioner, for them, is a rare illness as NF1, as other schwannomatosis. So they absolutely don't know it. So you have, I think, the major entrance door for a major patient is when you have to go to surgery, and more often you meet a surgeon, but not a neurosurgeon. Often it's an orthopedic surgeon that remove the first tumor, and then the analysis in the laboratory confirm it is schwannom. So it's the way most of patients are going to the right system when the first tumor is analyzed. But now, if you know it, you can type on Google and you can find the address of the reference center that is located in Paris.
That would be the role of the patient, you think, to do this kind of search on Google, to know where is the reference center? But they have to know the reference center exists.
I think it's hard to say. It's hard to touch. I think what is difficult is that all the doctors cannot know every single rare illness, and I think can understand that, but it would be it would be nice if we find a good communication system to warn patients when the diagnosis is made. I don't know if
within your care journey, to find the right doctors that know about your disease, who are specialists in your disease, there's a lot of journey, a lot of steps before you get addressed with those. And one of the role of the patients as well, sadly, I would say, is to do the search themselves, try to find the reference centers. And you need to live nearby to it, otherwise then we come into the logistic issues. That's capturing what your thoughts.
I think when the diagnosis is made, it's more easier, but the schwannomatosis sometimes the good diagnosis takes time to be made for some patients.
Of course. In the sake of time, I think you guys you mentioned the same issue, right? When we spoke, I would like to go to another topic, and maybe this is due to the fact that it's a rare disease. And Carmen, you share for you one of your burden was the lack of knowledge from doctors, because NF1 is rare, and therefore the problem in the referral system to the reference center is an issue because people don't know. That's something you expressed. Am I correct?
Yeah, because sometimes the doctors for a specialty only takes that you have a problem with your spine or your eyes or whatever. But don't take into account that you have MS1 and can affect to other areas of your body or other diseases that can connect. A treatment can make more damage than fine if you don't take into account MS1.
Mm-hmm. Okay, so what you're saying as well here, there is a lack of comprehensive care for you, and the treatment is segmented by the specialty of the doctor. So you're missing this overview from your care team as a team. Yes.
Mhm.
Shiva,
Yes.
I see you nodded. Would you agree with this?
Yeah.
Yep. And Gillian, what about you? Do you think doctors not knowing the disease because it's a rare disease cause immense trouble and decrease your chances to get a treatment as fast as possible?
Yes, definitely 100%. I find the doctors are asking my husband's opinion instead of us getting their advice. And then like that, we're waiting for MRIs or surgery, or it's just that the doctors don't seem to be well educated
On this topic?
Yeah. Like, and it is so frustrating.
It's frustrating. And you guys, I mean, I want to ask like maybe a naive question, but do you think like a centralized, trusted center of information would help, where you guys, or maybe that could be the role of patient organizations, would be to refer, and then you can educate the doctor. Maybe they can read about the disease because you are one of the only ones they're going to see during their career. So would that be really helpful for the treating physicians that you're meeting from time to time?
Well, for me, in one way, yes, in another way, no, because they're qualified doctors, so they don't want to be told information that they haven't studied. So, and then in another way, some doctors will take that information on board and take leaflets with points of NF and how it affects each part of the body, but that's not every doctor.
Of course, I understand. Shiva, would you agree?
Yes, but I would rather say, like, we have in Germany, we have a page of the NF Association. We have a website with information for patients, I think also for doctors. And I think that doctors have the possibility to do the research in general. And I think it's rather the problem that they don't have the time to do this for each patient individually. So I think it's rather a system problem than the problem of the doctor itself.
And that's really good. Not that really good, but it's a really good topic, and that lead to the next topic that I like to discuss with you guys is the experience at the doctor office. Okay. When we discussed, it was a month ago, you expressed that it was difficult. It was a painful experience, a frustrating experience, I would rather say. Shiva, would you mind like piling on this? How do you live what's your experience, what's your insights when it comes to your visit at the doctor?
Do you mean in general or with the NF specialists?
Choose or both.
Okay, so I think for the NF specialists, it's no problem because it's their specialty and you don't have to like do anything. That's more like the time. That's an issue that you don't get like enough time. But if you go to a general practitioner or a specialist who does not really know about NF, it's like I don't feel always comfortable with educating the doctors because I think that I'm not a doctor, but I'm telling you something about medicine. I'm trying to explain you something. And I don't always feel comfortable doing it because I feel like I'm like crossing a boundary. But I think it's like the only way that it's possible to get the doctors to know about it, because many doctors like I don't know if it's ruining the time. If they don't want to, I believe it's ruining the time. They don't educate themselves because they don't have the capacity to do so for every patient that has a rare disease.
Damien, would that resonate for your personal case? About the experience at the doctor office, the fact that they may not know your disease, which can be frustrating because you're kind of educating them on medicine specialty, as Shiva said.
I've been lucky to be quickly addressed to reference centers where I met one of the French specialists of schwannomatosis. So I cannot speak really about problems for me. As Shiva said, when I address him, when I meet him, he knows very well this illness. So I don't take time to explain everything. Still, there is the same problem of time. Like he got a lot of work and very small time with each patient. So that can be a problem if you want to address your story or your experience for a long time. But I don't see my general practitioner for that for the schwannomatosis.
Thank you for sharing. Carmen, I'd like to address a specific point with you, which might be specific to NF1, but I don't believe so. You're mentioning you did agree with the fact that there is not enough time right at the doctor office, and you mentioned as well, if I recall correctly, that you had to repeat your story again and again and again and again. And therefore, you're losing quality time with your doctor. Is that something that resonates? That's something that you live still?
Yes, because right now maybe the time we having it's time I go is 10 minutes. 10 minutes to explain my problem in that moment. Not all my story from when I was born. And I admit that too that I am in an organization of affected people and patients that offers to send emails to the doctor, to the different doctors we have about NF1. They don't care.
Okay.
So I have to spend like I have 10 minutes. I have to spend 5 minutes just telling all the story of my life.
Yeah.
To go to the point of what is happening right now to me in this year.
I can understand that. That's frustrating.
Yeah.
Gillian, is that something that is the same case for you in Ireland?
Yes, definitely.
Yep.
As an adult, I could be waiting 4 years to see the neurologist, and I'm in with them maybe 5-10 minutes max, and I come out with no newer outcome than what I went in with. But then with the children, for their clinic, our new clinic is new, so they do spend longer with the children, which I suppose is progress for us in our country. Yeah.
Okay, so we talked about, except Damien, that because you were addressed to the right doctor really quick after your diagnostic, maybe you want to share a story as well. It's regarding the psychological support that you get during your doctor appointments. I think that was a positive story that you want to share to try to see if we can extend that across borders.
Yeah, there's some good stuff too. So we are lucky in France to have the reference center in Paris, where things are a little bit maybe more better organized. So when you have your appointments with the neurofibromatosis specialist, you have the possibility to meet a psychologist. It's a woman in Paris that is just affiliated with neurofibromatosis. So she knows very well those illnesses, and so when you speak with her, she can really understand what you're being through. And the other thing that is well organized is that patient association in Paris once a month when there is the schwannomatologist consultation. They have now it's very recent an office that is booked for the association where patients that go for the first time seeing the neurosurgeon, they can meet a patient of the association, but that is already diagnosed for a long time and that knows the illness well, and so they can like welcome the patient in the and provide more information that the specialist would give in few minutes, as other people just said before.
And is that helping a lot the patient, the newly diagnosed patients, do you think?
Yes, depends on the patients. It's not something easy for the patient of the association to make a contact with new patient that can be first afraid about all you can say to them and what their future is gonna be like, because this is from history of from patient, and every patient have a single a different history of illness, of surgery, of pain. You cannot really compare in schwannomatosis two patients. There is some light form and some really severe form with chronic pain, intense chronic pain. So the first contact is difficult to make, and some patients react as I don't want to hear from it now, but I think the majority is grateful to talk with someone after this the diagnostic is made.
Maybe some people don't want to have this first contact right after the diagnostics, but they want to engage maybe later. So that's also an option that they can whenever they want, when they feel comfortable. Then there is flexibility in this.
Yes, and that's it. That's what is made with the contact of the association and number of some old patients that accept to be called for further support. So
that's a true commitment. That's a true commitment. But thank you, guys. So now I'd like to touch upon a new topic, which is the transition between pediatric and adulthood. Okay? Because when we discussed, some of you were diagnosed as when you were a teenager, and then now you are obviously adults. So I'd like to discuss how that what did happen between this transition. And I think, Carmen, you have a compelling story about that.
Yes, I was diagnosed with NF1 when I was 9 years old, and I was in pediatrics until I was 20 because I have very major issues with my spine, and they have to find neurologists that cover this and the other major diseases and illnesses. So I was in pediatrics until I was 20 something, until I could move to another hospital.
Okay. And do you think that impact your chances to have a proper treatment and proper care?
I don't know. Right now, looking at the past, I don't know, because there's no one only doctor. Sometimes it's the only available. So sometimes we can see the same doctor for years, or sometimes it's this month this, the next thing in 6 months, another one.
No.
I don't know.
That's fair. That's fair. There is no right and wrong answer. Thank you for sharing this story. Gillian, back to you. You're the mother of 2 children, I believe, who are 4 children who are living with NF1.
Mm-hmm.
Can you share your story? What's happening in Ireland for your children?
Well, Well, for my children at the moment, in the only clinic in Ireland, which is in one of the hospitals, they will discharge children at 16 they'll refer them to another doctor, a neurologist or pain relief doctor or ophthalmologist or whatever it may be. But when I was 17, I was discharged from children's services and I was sent to different doctors who didn't have really much information on NF. So I could have been seeing about 10 doctors, my spinal doctor, pain relief, neurology, epilepsy, and there's no continuity of care. And then with my children now, that's what my concern is, that they'll be left with no adult services, because there is no adult service in Ireland at all that deals with NF.
So you think that they're being discharged too early, or there is not enough transition?
There's not enough transition, and there is no adult services.
And because of the lack of adult services, do you need to seek for care elsewhere?
Yes, sometimes you're referred to, it could be the north of Ireland, it could be England for different treatments, but then that's either costing the Neurofibromatosis Association of Ireland or the HSE, which is our public centre in Ireland, but that has to be approved. So not everyone will get approved for cross-border. And then if you get refused, you're just left waiting. It could be 4 or 6 years before you see another doctor.
And I don't want to talk about geopolitics here, but because the UK is not part of the EU anymore, is that an added issue for you?
At the minute, not so much, because they have built up a good rapport with the UK. So I'm hoping that will continue. But then, like you said, politics can change. So we're kind of in a no man's land.
Okay. Yeah. No, that makes a lot of sense. So thank you for sharing this story with your 4 children.
Thank you.
So we now have half an hour into the recording. I would like us to spend only a few minutes about the role of patient advocacy groups, right? National, pan-European, or even global, regarding several topics. So do you think patient advocacy group can have a role in finding the right doctors for you? So in improving, in working with you on the referral system, with the system on the referral, to finding the right doctor. Do you think that's something that they can help you with? They can help the community? They've done that?
Yes, 100%. Like our association in Ireland, it's only made up with either parents of children with NF or they have NF themselves. And we get information from with each other about what doctors deal with certain things. So that does help us in one way. But then the commitment of people suffering with NF, it's poor, because we can't determine when we're going to be in pain or if something pops up with our children. So it's just unfortunate doctors aren't on board with it at the minute.
Thank you. Finding information. Do you think patient advocacy group, they help immensely the system by providing information to patients, as you said, Gillian, but also maybe to healthcare professionals and doctors? I think we heard that as well today, right? Am I correct?
Yeah.
We said that one of the German NF group can provide information to doctors, right?
Yes.
Yeah, and added value to the system also. In finding peers, so peer support is extremely important. I think, Damien, you shared this story about peer support. This is organized within the system by the French Association. So that's also something that helps a lot the community and goes hand in hand with the healthcare system. Am I correct?
Yeah, it is by the association and furthermore by patients themselves with easier way, like WhatsApp group. And of course, it's daily support for most of patients, like for the subject of pain, to share with people that understand you. So yeah, it's a major support.
Yeah, no, of course. And what about collecting data and contributing to research, clinical trial? research. Have you been involved? Do you have information about clinical trials? Would the doctor give you information about clinical trials? Are there any clinical trials in your disease and in your country?
In ours, sorry.
Sorry, I think Damien, you were first. You're raised.
Okay, sorry. Okay. For schwannomatosis, the lack of treatment except surgery. There's a few studies, but in France we're not involved in clinical study. There's some theoretical study, but at early level, not close to human experience. Yeah, fundamental research. I think the CTF supports some research but more in North America. But in France now, I don't know patients involved in clinical trial.
Okay, sorry. Gillian, you were second.
Yeah, we were offered by Stanford University. They took DNA from us and they sent them over and they sent out traits and DNA and new ways of, I suppose, genetic studies for NF. And then we have another clinical trial for the Selmatab for the plexiforms. Now we got refused that, but we are working on it as an association to get this trial drug over here, because at the minute it's not approved. But we are working.
Okay, so the role of patient advocacy groups here is also crucial.
Yeah.
Shiva, you also wanted to say something.
Yes, so I think it's really good to have these patient advocacy groups, patient support groups, because you can like easily reach many people from different social situations, different ages. And I mean, for me, I wrote my master's thesis also about the topic of patient experience, and it was really nice to have good access to to people with NF1. So I think it's good for like in purposes of research to have good access.
Good, thank you very much. So for me, the key message here is that patient group and healthcare professionals and systems work hand in hand, right, to support patients, to foster research on science, to research on quality of life, and with all the other stakeholders to find a cure or a care, basically to make the life of people living with NF1, NF2, and schwannomatosis better. That's the role that organizations such as the Children's Tumor Foundation can play. And so that's also very important to take them into account as key stakeholders as well. So thank you very much again. We're done for this recording. Now it's time to give the floor back to Marco for the Q&A sessions, and for people online they will have the opportunity to ask you questions. So thank you very much, and looking forward to hearing the questions.
Hello, everybody. Hello, everybody. So we don't have many questions yet in the chat box, but I have myself a lot of questions. So, but we have one from Catherine Battle in France. It's not exactly a question, it's a comment. And she reckons that it refers to the bit you were talking about, general practitioners not being informed about NF and the difficulties that you encounter due to that. But Catherine actually added one layer to the thing, and she says that she thinks that general practitioners should be the ones giving the information about the patient associations. I was wondering if you thought this was a good idea, that you know, we try as a community to actually inform the GPs that patient associations exist and that they can refer to patient associations in case they need information about the disease. I don't know if any one of you wants to answer this question. Maybe I should reformulate it. It wasn't very clear.
I'm sorry, I had a little technical issue. Can you repeat your question? Sorry.
Sure. I was wondering if you thought it would be a good idea that the general practitioners were informed about the existence of patient associations, so that whenever you are referred to a general practitioner, and an NF patient, especially early in his or her journey, is referred to a general, needs to interact with a general practitioner about their disease, that the general practitioner can direct the patient to the patient association, because apparently some patients also have trouble identifying the patient association.
Yes, for sure, but it's the subject of rare illnesses, and I don't know if each illness should be if the general practitioner should be aware of each rare illness, because it's really difficult. But maybe it should be a reflex to address for each patient association. But maybe not specific association, but maybe the general practitioner should know where to find the correct information and address of those associations, and it could be a reflex for each patient. I don't know if I'm speaking correctly, but yes, each doctor should be able to find the correct information about patient association for rare illness, and the information should be available easily, for sure.
Sure. No, actually, Catherine corrected me. I had misunderstood her answer, and she meant, do you think that the general practitioners should learn during their studies that for rare diseases there are reference centers, and that it should be taught to them very early on in their career that reference centers exist, so that it becomes embedded in it becomes embedded in the profession that reference centers exist for NF, and that they should, if ever they have a patient affected by NF, then they should be able to identify that reference center themselves.
Yes, for sure. Yes. Yes.
I know.
Gillian,
In Ireland, we are building up a patient register, and well, it's slow at the minute, but we have done a care pathway and we have checklists to send out to GPs, but we don't have one system in our country where any doctors can use references. So it depends on the hospital. And I know, like my GP, he was training, and he said only that he came across a child in one of the children's wards with NF. That's the only way he would have found out about it. And I think a lot of the GPs are the same.
I actually wanted to, I had a question myself also regarding clinical trials. Now, we know in Europe, where you all come from, there are very, very few clinical trials for NF. Things are changing. There are some programs being set up that will open, but with time, it's not going to happen tomorrow. But I was wondering, if you think that, because there's always this thing with clinical trials, it is an experiment, and patients tend to join because they hope, of course, this will give some result. And there is this balance between the experiment and having a therapeutic option. Do you see where I'm going? And I was wondering if any one of you has had a thought about joining actually, and say, maybe I want to go for I would like, if there was a a clinical trial available, would I join it? And why would I join it? I think it's very important for the audience to understand why patients would want to join a clinical trial.
When I was 22, I was offered by my neurologist to join the genetics, to make a genetics test. I agreed. I think it was only a blood test, wherever they needed, and never again hear nothing about them. So I don't know why. I agreed to help myself, to help others, but I never hear an answer from them. So yeah, exists here, but I don't know why, because no one ever reached me to make some answers or to ask for more blood or cells or whatever.
I see. Does anyone else have, Mathieu, you want to comment?
Yeah, I have a question, maybe a more general question, which is beyond clinical trial. But if you guys had to change one thing in your interaction with the healthcare system, what would it be? Because we talked a lot about the logistics, finding the right doctor, the lack of a comprehensive care. We talked a lot of things during the masterclass. But if you had to pick one which is easily implemented, and if you had to send a recommendation to CTF to advocate to change one thing, what would it be?
If I can speak for schwannomatosis, is to support more clinical trials specific addressing the problem of schwannomatosis. If I can answer the two questions at one time. When I recently made a research, because I work in the medical area, about the clinical trials ongoing in the world. There is, at my knowledge, only 2 clinical trials specifically looking for a new treatment for schwannomatosis. So this is really scarce. And this is a major burden for people and a subject of anxiety, to know that the only treatment they can have is surgery, which have some problems too. And so I think people are ready to participate to any programs. There's some already existing medicine that are on the market that are potential treatments to slow the growing of nerve tumors. And I was wondering if I would take some of them, and I think yes, because we don't have any other alternative if I accept surgery. But surgery is sometimes not possible because the nerve tumors are really deep and with risk of major burden and morbidity after the surgery. So yes, I think people in all those illnesses need more research, results, new treatments, and a global survey.
But is this an area, Damien, where you think a higher level of partnership between the patients and the clinicians should be installed? Because the partnership, when the patient finally arrives to a reference center, I understand there is a partnership there because it starts working. But then when it comes to clinical trials, maybe it's a subject that is not being touched often enough, etc. But do I understand wrongly or correctly that that there isn't an established partnership with your centers regarding clinical trials. There is a partnership regarding the day-to-day care, but not regarding the clinical trials. Is this a correct interpretation?
From my point of view, yes, there are some studies, but that are more epidemiological studies or general study, but not in clinical trials. Yes, I speak for schwannomatosis. Yes.
Yes, it's the same in our country, except like we do try and sign up for clinical trials, but our health service, they're the ones that have to deal with whatever people are doing the clinical trials. Like last night we were on an NF2 call about for Swantos and new clinical trials. But someone from Europe asked, could we do it? And they said, well, yes, you can, but it's down to your government or your the health service. Like, so the small person is trying their best to reach up high to trying to get things done. Well, hopefully things will improve over here with more communication.
Sure. And do you feel like, you know, patient associations should be supporting you in establishing these partnerships regarding clinical trials with the various centers that actually perform clinical trials?
Yes, definitely, because it's only going to benefit the people in whatever country. It's only going to help them in the end, and then the future people that will get a diagnosis.
Well, thank you. I don't see any other questions. Mathieu, is there something you'd like to comment on?
No, I think the only thing I want to say is thank you again for giving me the opportunity to moderate the discussion. We got a lot of pre-discussions to prepare the masterclass, and I hope that it will be a success when it will be put online as well. So, and thank you for the participants. I really enjoyed that moment. Thanks. Thank
you very much.
Thank you. I actually have, we have still 5 more minutes. I wondered, I'm going to ask a very strange question. If you know, this webinar will be posted on the internet and it will be accessible to all, and we hope to all the healthcare providers, regardless of whether they know about NF or not. And I was wondering if there was a GP, you know, who doesn't know anything about NF and who watches this, who is watching this webinar right now, or if we'll watch it later on. Is there something that you think is special to NF that you think they should know so that they want to work for NF, so that they get passionate as much as the patient associations and the reference centers about NF in particular? What would you, Carmen?
I would like to. This for me, the NF is not only that covers medical, because sometimes patients have learning issues like dyscalculia, and this is not something that teachers maybe should have in count when they told, well, this patient have this disease, like just talking with that teacher, they have some problems. This is something with this disease, because when I was little, I didn't know. I was like a regular child.
Does anyone else want to comment on this? Well, I thank everyone on the screen today, starting with our 3 wonderful patients and Mathieu, of course, for this session. which will be posted on the YouTube site as soon as practicable after this masterclass. We are going to pause the masterclasses now until September. The next one has already been lined up. You can register for it on the CTF Europe website. And again, I thank the audience for being here today. And I hope to see everyone very soon. Thank you.
Thank you.
Thank
Bye.
you.
Thank you very much.